MDoc we're focusing on addressing the treatment gap of mental illness globally. A meta-analysis based on observational study showed that 1 in 5 people was affected by common mental disorder in 12 months preceding assessment. Neuropsychiatric disorder attributes for over 10% of global burden of disease and are the leading contributor to years lived with a disability. Among various diagnoses, depressive disorder is ranked as the single largest contributor to non-fatal health loss. Furthermore, projections by the World Economic Forum stated the global economic cost of mental disorder is estimated to increase from 2.5 trillion in 2010 to 6 trillion by 2030. In contrast to the huge burden, 45% of the world's population still live in areas that have one psychiatrist serving more than 100,000 people, mostly in middle and low-income countries, as you can see with the lighter color area on this map. Despite this huge gap, we can leverage existing healthcare providers by equipping them with effective tools and providing customized training. This way, we can expand our healthcare provider force by almost 8-fold through training and supporting nurses working in mental health area, and even 900-fold by empowering healthcare frontline workers. You might ask, how can we do that? Fortunately, the growth of mobile devices have really enhanced the digital connectivity across the globe. In 2003, we had 1 billion unique mobile subscribers with 17% market penetration. The market penetration almost doubled in 4 years and tripled in 10 years. By 2017, we have 67% of the mobile users and 57% of population having a smartphone. The growing penetration of mobile device also germinated the growth of SMS-based healthcare ventures, as well as digital health apps for smartphone users. To address the gap in access and affordability for treatment, we developed a platform to provide a customizable mobile program for providers to individualize patient care and maintenance. Our programs are provided by the community of healthcare providers for the use of the peers to engage patients between visits from the comfort of their own mobile devices. The healthcare provider's journey starts with the content creation, where they can identify programs and we will help them digitize the program and upload them into our platform. After that, the content creator can prescribe the programs to their patient as a complement to their current treatment. We will work with their team to onboard their patients by downloading our app in their smartphone. For providers who don't want to create programs of their own, we can still use our platform to identify programs including treatment and training that they need and then download them to their portal so they can prescribe them to their patients or use it themselves. For patients who don't have a smartphone but still own a mobile device, we will work to adapt the content by leveraging on the messaging capability. After program delivery, the healthcare providers will be able to monitor the usage activity from their patient, client, as well as the performance trend. For example, standardize the questionnaire, testing score, inventory list. With the feedback from their patients and client, the healthcare providers can fine-tune their program to better serve the individual needs dynamically. As we get more data and insight, we would be able to move on to the second phase, an AI-supported recommendation system where we leverage on sophisticated algorithms to recommend a digital program based on few inputs from the healthcare provider. This would help the provider to make decisions more effectively and amplify their care even when they are not with their patient or client. This will also enable us to collect more data to further improve the performance of the recommender system and gain insight and efficacy of different treatment based on individual characteristics. MDoc is a platform where healthcare providers, starting with mental health, can create, access, and customize actionable mobile programs for patients to facilitate the treatment that is happening in the office. With our program, we'll help healthcare providers build rapport with those under their care and facilitate adherence and buy-in to the treatment. This will be a vital tool to improve the mental health and wellness of the end users.